Hello again, everyone. I'm Dennis McCarthy with Upper Allegheny Health System and Olean General Hospital, welcoming you to another edition of Inside Olean General Hospital, our news and information program bringing you some really valuable information about Olean General Hospital, its people, and its programs. Today, we got several interesting things to talk about, and it has to do with patient protection, patient safety, and infection control. And we have with us today Julie Kenyon, the Infection Control Manager for Olean General Hospital. And a little bit later, you're going to meet Violet. And Violet is actually standing behind me, the silent guest that we have on today's program. We're going to talk a little bit more about that later on. You know, protection of patients in hospitals is a primary obligation of any hospital in this nation. And it's certainly true here in Olean. And the staff here and the administration are very, very proud of the efforts that they've made to ensure patient safety, protection, and infection control here. As a matter of fact, Olean General Hospital was recently named by the Leapfrog Group, which is an independent rating organization, as one of the safest hospitals in Western New York, and one of only 3 in Western New York to receive a grade of A in patient safety. So congratulations to the staff here and all the efforts on behalf of you, Julie, and I know that you've done a lot of work on this particular subject. But let's talk a little bit now about the kinds of things that our hospital does to protect our patients from harm.
Mm-hmm. Olean General, we do have several programs that we do here at Olean General. One of those is from an infection control standpoint, is isolation and contact precautions of our patients. Any patient who has any history of what we'll talk about a little bit later, MDROs, which are multi-drug resistant organisms like MRSA and VRE, are put into an isolation, and our staff are asked to follow policies regarding gowning and gloving and hand hygiene. The other thing is we do a lot of hand hygiene surveillance, infection prevention, as well as we have secret observers throughout the hospital, and we use our safety champions as well.
Talk about the safety champions. Who are they?
Safety champions are a group of trained employees, I think about 63 of them hospital-wide, who have had specialized training to help be the eyes and ears of the hospital as far as safety and protection of our patients.
They serve on committees, they observe, they're involved.
They do. In fact, they serve on the Infection Control Committee. We have safety champions that participate on Patient Safety Committee. And they're also trained to be some of our secret observers in the hospital for hand hygiene and as well as monitoring of staff wearing isolation.
I want to talk for just a second. There's some other programs here that are really specifically designed to help protect patients. And one of them is called Stop the Line. Could you explain what that is?
Yeah. Stop the Line is a program that was introduced in the middle of this year. And it's where it empowers employees to actually speak up and speak out or stop another employee or healthcare worker if they see something that has a potential risk of causing harm. For example, if you have a coworker who's walking into a room without washing their hands, you have the right to speak up and stop that employee and say, I see you didn't wash your hands.
So we have that, and that's really a built-in process to say basically, stop sign. You know, we've got a problem here. Make sure we don't go any further. And there's also something that we recently introduced here. It's called the Patient Speak Up campaign. What's that about?
Well, like the Stop the Line program that empowers our employees to speak up, empowers our patients to speak up if they see something. It gives them the opportunity to ask an employee if they wash their hands prior to taking care of them. It also gives them the opportunity to ask about, devices like urinary catheters and
things that
IV lines and different things that if they're really necessary.
People hear an awful lot about infections in hospitals across the country, thousands of hospitals, and concerns about it. You read in the paper that certain hospitals have higher risk and they have infection rates and things like that. Well, let's dial back a little bit to the basic. Why do people get infections in and around hospitals?
That's a very good question. A lot of it is decreased immunity among patients that are hospitalized,
Right.
our aging population, and the fact that healthcare is seeing sicker patients. The other things are increased variety and invasiveness of procedures that are being done. We're doing a lot more in the hospitals than we used to do.
When you say invasive, you mean their operations and procedures and where patients are more susceptible to?
Things are more complicated,
I see.
and we're taking care of higher risk
Okay.
patients. The other thing is increased drug resistance, specifically related to antibiotics.
Let's talk about that. Just as what's happened with antibiotics, and again, we hear a lot about it. What's going on? Antibiotics don't work anymore on people, and what are the reasons that that's a little bit of a concern for? That's a fight that hospitals have to take on, even though they're not the problem, right?
Right. It's not. We're seeing more resistance only because antibiotics are being ordered and taken sometimes when they're not really necessary. For say, the common cold. Instead, if you don't have a bacterial infection, your antibiotic doesn't work. But when you take an antibiotic or you don't continue an antibiotic as you're supposed to when it is needed, the bugs and the bacteria tend to, as they want to say, mutate and become resistant to the antibiotics.
So they're figuring that these bugs essentially are almost like they're smart, and they're figuring out another way to beat the system.
Kinda.
In kind of a strange way, and then they're tougher to deal with later on. And,
yes.
And this has happened over many, many, many years in this country, right? The antibiotics have been administered, and then they got to figure out a stronger one or a different one. Is that how it goes?
Yes.
Okay.
Yes.
Okay. So, infections, how are they transmitted? What do we think about? How do people get an infection? Coughing, hand to hand?
It's usually in a healthcare facility. It's usually cross-contamination. We try really, really hard to try to keep the environment clean. But sometimes it does get missed. Things do happen. And usually when you see cross-contamination, it's because the patients come in contact with it, sometimes by the healthcare workers' hands.
Yep.
Or on the surface.
Yes.
Our bedside tables, the bed rails, the different things that you come in contact with, those environmental surfaces. Very rarely do you ever see a direct patient-to-patient transmission of an infection.
And some are they transmitted through the air too, or is that's relatively uncommon?
That's relatively uncommon. Okay. I mean, we don't see too many airborne airborne.
It's not much different than at home, is it? Other than the fact that there's more concentration here, the higher concentration of patients, but it's the same kind of things. And how long do these, call them bugs? How long do they live on a surface? I mean, can they be there for a day, 2 days?
Some of them can live, months, or weeks, months, sometimes, several months.
So I know our environmental services people work very, very hard in terms of keeping our buildings spotless. I think anyone who's been to Olean General Hospital will notice immediately how clean this facility is. And as a matter of fact, it has been rated as one of the cleanest facilities in the state on another survey instrument. But so we're working very, very hard at trying to keep everything in check, keep patients safe, and make sure there's every effort's being made to reduce infections here and increase protection of the patient. Okay. Well, what I want to talk about next is there's another guest here named Violet who is standing behind me, and maybe we can talk a little bit. This is a new piece of technology, isn't it, that we have here?
It is.
And if you could explain, this is basically, I'm going to say it's a light tower, and we're going to demonstrate this in just a minute while we're talking. So explain what we have here. What is this?
This is our Clorox Optimum UV technology. It is an ultraviolet light which breaks down the bacteria or germs on the surfaces.
So it basically neutralizes microorganisms and bacteria and makes them ineffective. Yeah,
we're coining the word the germ zapping.
Okay, it's a germ zapper. This unit does not replace hospital cleaning, correct?
No, it doesn't, Dennis. It actually is a supplement to our standard housekeeping here at Olean General. Um, and it's really becoming standard equipment of many hospitals across the country. And I guess, we can really be happy to say that, Olean General is one of the first hospitals, actually the only hospital in Western New York and the Southern Tier to begin using UV technology as part of our environmental service cleaning process.
We also have this unit at our hospital. Bradford Regional Medical Center also has this UV unit just arrived at that facility. So both the hospitals in the Upper Allegheny Health System have this technology now.
Yep, and we're going to be using it, in our patient rooms, especially after our isolation cleans. We're going to be using it in our OR, which is going to, be a real benefit. And I'm certain we're going to see some really good results with it in our fight against hospital-acquired infections.
That's great. So we've got two of these, and these were funded by the employees. Actually, the hospital helped fund this through the employee giving program of the foundation here. So applause to the employees at Olean General for helping making this technology available for everyone's health and everyone's protection. So, did we miss anything?
Nope, I don't think so.
Okay. Well, that'll do it for today. Julie, thank you for being with us today, and really congratulations to the whole staff here who worked so very, very hard at patient safety, patient protection, infection control, keeping the hospital clean, and making this the very, very cleanest hospital in New York State. Thank you for being with us today. This is Dennis McCarthy. Have a great day.